I'm Jeong Lee. Uh, I'm currently working for Thailand Program Management Unit for Competitiveness as a senior advisor. This presentation is based on the Inter-American Development Bank Consulting Report, which was drafted last year. And I have presented this to Latin American countries 2 times last February. Current waves, vaccination issues, and others are not covered in this presentation. June last year, I was asked to analyze the Korean system's capabilities. At that time, Korean system successfully controlled the virus and also developing and producing enabling equipments and solutions continuously. When Korea controlled the pandemic, Korean system was recognized as a unique system in the global society because the Korean economy is expected to be relatively stable with open and transparent border policy and also its robust innovation system. And when Korea controlled the virus, the Korean system was praised as a democratic system by the Western experts, scholars, and news media because they believe Korean democracy has defeated Chinese authoritarian regime. But a few weeks later, Korean success was downgraded to Confucianism because Western society and the European countries also affected and overwhelmed by the virus. And in this presentation, I would like to focus on the longitudinal approach to define problems and articulate solutions for effective implementation. In this way, we can conclude certain policy implications which are relevant to developing countries. The Korean government's response to flatten the curve. In the beginning of pandemic, Korean government had infectious disease alert levels. And February last year, the Korean government raised the disease alert to the highest level red when Korea was hit by the first wave, which was triggered by a religious sect of Shincheonji. And after Korea successfully controlled the virus, global society has paid a close attention to South Korea's situation, whether the country can continue to control the second wave of COVID-19. The institutional arrangement for emergency response. Apparently, commitment and sacrifice of medical and nursery human resources, central and local governments' leadership, and voluntary participation of disciplined people are the three core success factors to control the virus. These were enabled by a nationwide health insurance system and organizational and institutional arrangement, which was prepared by the 2015 MERS crisis, and the delegate management of the problem-solving oriented longitudinal approach and collective national system has founded all these institutional and also behavioral capacity of the Korean system. KCDC, local governments, relevant ministries have engaged in the process. The data, information on COVID-19 cases have been transparently shared among the population, and the coordination for test, trace, and isolation or treat among relevant institutions were quite well managed according to the institutional arrangement after the MERS crisis in 2015. The core of Korean response to COVID-19 is cluster identification and rapid quarantine test and isolation. And let me explain the science and industry virtuous cycle in Korea. May 2020, Nature has argued in its special issue that South Korea's top-down government-led approach to R&D policy over the past decades is a key to the country's success in controlling COVID-19. Apparently, the government or public R&D investment has triggered private investment and then has created the several decade-old virtuous circle and collective system. I believe this system has helped Korea to deal with the pandemic. In the early stage of Korean development, the Korean system was not well capacitized. The industry, science, both were weak. The Korean government utilized the future perspective of industrial restructuring to overcome the challenges. These future industries were promoted to lead to an increase in demand on high-skilled workforce. Similarly, the system dynamics of innovative drug development and global market deployment have been fueled by the process technology and new drug development capacity, biopharma research capacity building, backed by human resource and infrastructure, and global marketing and regulation strategy. These government initiatives have led to building the infrastructure for the pandemic response from a Korean research community. Science and industry relations and achievements during the COVID-19 will be explained. And firstly, drive-through system has symbolically demonstrated Korean system success and which was benchmarked globally. And the rapid development of diagnostic kits by the private companies of a few technology companies, which was supported and led by the Korean government, also globally recognized. And also KF series masks were globally well-known tool to address the pandemic. A few Korean companies make a strategic partnership with global vaccine providers to produce them in Korea. And also a few Korean technology companies began to develop Korean-owned vaccines. And majority of candidates for COVID-19 medicines being tested in South Korea are developed through drug repositioning process. Not only forecasting with a specific algorithm, Korean universities and research institutes have played a very significant roles in developing kits, tracing solutions, and vaccines and medicines development. And lastly, let me explain the legislation and regulation issues for sustaining the supply and demand of pandemic solutions. Sometimes innovation is challenged by regulation, but regulation sometimes facilitate innovation process. Similarly, personal data should be protected, but to deploy pandemic solutions, we need to ease the privacies. So careful considerations must be given to manage and regulations in sustainable ways. I have identified 6 regulation revision or adjustment during the pandemic process. The first 3 are related to demand, and the other 3 are related to supply side. The first three demand-related revisions. First, procurement. Korean government has used the official online procurement system to make contracts with the 125 mask producers. And secondly, the nationwide health insurance system has helped to mobilize medical resources and to ensure suspicious patients to get tested. And thirdly, two main issues of basic income and nationwide implement insurance were comprehensively debated among Korean population to prepare for the post-COVID-19 era. The other three are related with the supply. The first supply-related regulation is intellectual property rights. During this COVID-19 pandemic, the number of diagnostic patents has sharply increased. This is strongly compared when Korea was hit by the MERS challenge. And this was enabled through the early adoption and certification process of Korean government. And second, certification. Over the past decade, KGMP and drug regulations have become increasingly harmonized with international standards. And thirdly, personal information. The legislation enacted since the 2015 MERS gave the government authority to collect data from those who test positive to reconstruct their recent whereabouts. Conclusion. South Korea's response to COVID-19 was enabled by the institutional arrangement which was learned from MERS crisis and prepared from collective system creation. And it has also facilitated the process of stabilizing new institutional settings, as I discussed, and even changing people's attitude. Developing countries, including Latin America and development banks, may request the Korean government to provide a platform to design solutions collaboratively, to implement it in Korean institutional settings, and to bring the solution to their countries with relevant stakeholders of Korea. After summer 2020, Korea also had many waves, including the second wave September last year and third wave last winter. And Korea had also the vaccine hesitancy, and not the COVID-19 vaccine, but influenza vaccine hesitancy in October 2020. There has been many critics on sustainability of the 3T. The first 2T test and tracing focused quarantine with a sacrificial commitment of medical and manpower. But the medical people criticized that Korea failed to prepare the last T of treatment. And Korean system is also criticized in previous success lock-in, and this is continued to be discussed. Thank you for your attention.